Hello, my friends. Good afternoon, good morning, good noon, friends around the world. Myself, Habibur Rahman, I should say social worker Habibur Rahman, host of Community Talks. I'm very delighted to invite honorable guest from Grace in our Community Talk Series 9. That is a 30 or 35 minutes talk, four times in a month. So today we are very happy to introduce Mrs. Maria Morfidou. She is joining from Greece. She will talk about Greece social work, community social. Maria, welcome to this show today.
Hello, dear Mr.
Hello.
Rahman. Nice to see you. I'm very
Yeah,
honored
nice to see
to
you
be
too. How are
invited
you?
in this discussion. I'm very well. It is afternoon in Greece.
Yeah, good
I
afternoon from Bangladesh.
yes, time zone changes, but we are here to make a great discussion about community social work in Greece.
Thank you. So, dear viewers, let me introduce Maria. She is a very close friend of mine, and Maria is currently head social worker of Community Center of Thermi and expert of Global Shappers community. She's working in Greece. She's joining from Greece today, and she had a lot many contributions in the community people during this COVID. So we are very happy to invite you today, Maria, and you managed your time to join us. So I would be glad to ask you, how are you and passing your time during this pandemic over approximately 18 more months, right? This time, so Maria.
Yes, right. First of all, I would also like to thank our viewers for watching this discussion. I hope that everything we're going to say here will be very useful, especially for young people and the young professional social workers. Um, I will try my best to make you see a clear view of what Greece is facing during the pandemic. And I will shortly introduce myself and thank you for doing this for our viewers. I work as a community social worker for about 15 years in Greece. I work in several municipalities because I'm a contract worker. I work with contracts. I have no stable organization. Um, and mostly I work in European funded programs that may long last, but I'm the head social worker that needs to give flesh and bones to what the papers are saying for a service that it needs to be done and what deputies it has. So I'm a practitioner for about 15 years in several municipalities, in several programs, community programs. So that was a short introduction of myself. Um,
So thanks a lot, Maria. You might see, Maria, over the pandemic time, I have been hosting this talk series under Community Talks YouTube channel. It's published in Community Talks BD Facebook page. Actually, we have been hosting this sister concern or sister initiative of our foundation that I lead as a founding president. Its name is Community Social Work Practice and Development Foundation. As an academician, when I thought, yeah, I should clear this message to you why I've been hosting this and what is my motive before asking you a few more questions. As an academician, last year when pandemic hits in globally, actually in Bangladesh, first case identified on 8th of March 2020, and after that, gradually, actually, academic institutes shut down, and gradually all the institutes gets closer, right? Gradually. Uh, in the mid of May so far, end of April or mid of May last year, I thought as a social worker, though social work is not a profession in my country. It's an academic profession, not practice-based profession, that we learn that social work is a scientific method-based helping profession. Actually, it may be helping profession when we come out our academic teaching learning, and also practice our thoughts and skills and techniques, methods in helping people. So it touched me a lot when people lost their job. People actually got frustrated last year. I thought, as my institute is off, so what else can I do, or can my team do for the people, for the human well-being, for the humanity? Then it touched me, and I thought sharing is caring. That should be our motive. At least without any tangible actually investment, we can invite and connect more people globally. We can keep our social work community vibrant, motivated, and startups, so they can contribute people globally in their own community, in their own context. I started inviting friends, and more than 100 episodes so far in different ways. This is community talk series. There are some webinars. There are some talk shows, like inviting few more friends together, right? And conferences, workshops, so many things we have organized just to invite friends and share their views to other friends globally through this platform. Actually, as a social worker, I thought sharing should be the best motive of caring, staying far and distancing. So that was our motive, and this is the session is going on still. Community talks. Actually, that was our motive to care people globally. So as
That
you were
is
here from, thank
that
you.
is a great initiative, and I totally agree with you. Sharing is caring is also my motive, and
Excellent.
go local also is my motive,
Yeah,
and
yeah.
that is why I chose to be a community social worker.
So in the session, always I try in talk series, I mean 30 to 35 minutes time, I always prefer to ask our invited guest 5 to 6 specific questions that I design based on the context of the guest, where he or she is residing currently. So for you, actually, I thought and love to share from you to our global viewers uh, a few things about the organization you work for long time in your community, Maria.
Okay, yes. Currently, for the last 4 years, I work in the municipality of Thermi, which is a
Mhm.
municipality in northern Greece, near the co-capital of Greece, uh, which has 52,000 inhabitants. I work there as head social worker, as I mentioned before. I am in charge of a service that give access to people for the most of financial allowances given in Greece, which are poverty allowances and disability one. And I'm also there for adult counseling, while I am coordinating the team of 4 other experts, social workers, psychologists, and sociologists. I must say here that community centers in Greece were founded in 2017, while in most other countries of Europe already had this kind of local social services. A community center consists of experts in human and social sciences who are mostly responsible for briefing, updating, and orientating people, the community, regarding financial allowances due to poverty and unemployment. And also, we help them apply for those allowances. Uh, we consult them, and finally, we organize awareness events for all people. And I also have a collaboration, as you mentioned, with the Global Shapers community, which is an initiative of the World Economic Forum. This is the Thessaloniki hub. We have hubs, and it is a youth organization which promotes active youth leadership and wants to inspire young people to know more about themselves, to gain
Yeah.
knowledge, and to be more active in volunteer at the community.
But thank you, Maria. Just one observation in the whole world where social work's been taught academically or in practice, all the social worker always think social work is a comprehensive discipline. It's a holistic approach. It's very fruitful and significant for contributing the community, doing welfare for the society and the people. But still, in many countries of the world, social work is not profession. Social work is not widely known and recognized by the state authorities, the government, right? And in all the countries there is an emerging history or emergence of social work. If you ask me, I should say in Bangladesh, social work has been started in teaching area in 50th decades. This is a long history, but uh, if I would request you to share a few words about social work emergence in Greece or emerging of social work in your country throughout the time.
Yeah, sure. Social work is established in Greece around 1946. It was uh, uh, it was due to the Degree American College, this educational program, which led to the Young Women Christian Association, late 2 years later, to also establish a school for social workers, only for women, though. Uh, um, Now, currently, we have 4 university departments of social work, and of course, during these years, we have established our professional rights with the Greek state, and since 1955, we have also our professional association as Greek social workers. I should say that our association is very helpful and in many cases guides us to do the right things concerning the cases of people we handle. Um, but there is a lot of way to we need to reform all the Greek social policy issues about making them more to the modern needs and we need
Yeah,
to
still,
even to be even more focused in modern times and modern aspects of life.
yeah. Still so many things to do. And social work professional association has so many things to intervene really to make a hook and liaison with government and the state authorities. Still
That's
same cases here,
right.
but we are fighting to be recognized. Thing is, we raised our voice, our respected senior teacher, I mean, faculties of universities, they raised their voice, they try to communicate with the government and the ministry. But problem is, professional association definitely in all countries must have a power and a significance itself for their existence. But in our country, professional association is not active. Actually, I didn't find active any professional association who can communicate with the state government. Actually, who are the authorized body to finally recognize us as a social worker. So we are fighting for this, and that you share in your community regarding your community center. So far I could guess there are variety or dimensional workers and professionals are there. So Maria, can you share me with and also with our friends, uh, what areas are your actually professional expertise or you work in or contribute for the community center?
Yes, as I already mentioned, I work as a head social worker in a community center, and that
Mhm.
means that I should provide front desk services to citizens by briefing and orientating them about financial allowances that the state gives, and help them apply for those allowances, make sure they understand the procedures and the legal terms of an allowance. And at the same time, I have also the responsibility of adult counseling. Um, and also, I have to be informed about all the actions taken by my colleagues, my team. I have a team, as I mentioned before, concerning the community. Our mentality is to make citizens more active by raising awareness and by strengthening them, their abilities, their confidence, and motivate them to do something more, something more for their selves and their community. Um, this way, it is also a great possibility to have a basis of a volunteer system,
Right.
and that will help us to have extended social services in the community by volunteering.
But
Uh,
Maria, if I interrupt you just for a
mhm.
queries, during this pandemic, actually before pandemic and during pandemic or after effect, social work changes or social work gets several dimension of work or intervention, right? And country globally are facing different problems based on their own context, like problem crisis in America or crisis in Bangladesh or India, even in Greece are not same, and standard and the strength of social works not same because of the range of their jurisdiction and power and the professional affiliation. So if I ask you this time, in your own community, I mean the Greek community, what type of problem they are facing due to COVID-19 and how you are responding actually?
That is a great question. We have to overcome and face mostly many difficulties in Greece. As you know, since 2010, we were in a economical crisis. We had uh, increasing the levels of unemployment. We had the Greek state was forced to be under the control of the European Union's constitution, known as Troika, if you if you know. So the Greek recession was a big deal for us. Was a big deal to face. Plus, um, the immigration issue also came up. We had many refugees and seeking asylum people coming into our country. Uh, from many countries of the Middle East, like Syria, like Iran, Iraq, Egypt, Pakistan. They were heading west, and they wanted to enter Europe through Greece. Sometimes they manage to go to another country, the country they want to go, but sometimes they are forced to be in Greece while their documents are being prepared, or while the other country gives them access, so they could go there. We have also immigrants from Albania, Russia, China, that were immigrants since the 90s and the millennium. Um, Let me give you some data. concerning the number of people that legally stay in Greece, and my source is the official report of the Greek Ministry of Migration and Asylum. These are for July, for
Mhm.
last month. We had people from other countries of the European Union and expatriates around 209,000 people. 666,000 people from countries out of the European Union. 55,000 people, no, 58,000 people, beneficiaries of international protection. And we have more for July, we have more 63,000 applications to be under control. So we are talking about around, let's say, 800,000 people for July that legally stay here in Greece. Not to mention the ones that don't have legally permission to stay here, and they're staying without migration permission. And
Yeah.
also, in this problem, we had to also face the pandemic crisis, and also the weather phenomena, as floods, as fires. You know, we have spent around 1 year and a half with the pandemic, and while during this time we had serious floods and disasters from
Yeah.
heavy
Yeah. So
rains,
many.
freeze, and
See.
many people had lost their houses and their jobs because of that.
Yeah.
And that was a very complicated issue to handle, but who did the hard work? A social worker did the hard work, because we suddenly had to
But Maria, just actually, this is my curiosity to ask you that a social worker can be uh, the professional in, or can be the expert in child area, in family counseling or family feud mitigation, or in industry or medical setting or dental, right? And
yes, we have
law,
clinical social workers, we have
clinical part,
educational
right?
social workers, we have childcare social workers,
Yeah.
we have community social workers,
But
but mm,
my question is actually that is very similar. My passion to be engaged in community, and when I thought the community term exists or include three things, always I actually teach my students this way, that there is we feeling sentiment in community, there is rule feeling, and there is locality sentiment among the people, and all the problems are lying in the community. Community includes people of versatility, people of different races, culture, right? And so many people are there. That's why I think work in community or become a community worker, it's actually it's my passion to be involved in. So that is my goal to, you will be happy to know that I shared uh, my leading foundation's name is Community Social Work Practice and Development Foundation. It is licensed by the government to work in home and abroad. And this session name is Community Talks. We publish a newsletter that I sent you earlier, Community Talks newsletter. Facebook page is Community Talks BD, and the professional group that I maintain, it's Community Social Workers Network BD. So I have a madness with the term of community, right?
community.
And yeah, and you and me are in the same track. So my last question to you, what kind of madness or passion you have to groom to be grown up with your professional goals as a community social worker?
My dream is to make real the term of social cohesion. This is my dream.
Excellent.
As you already said, we are all citizens of the world. We need to live under the same municipality. We are not Greek people here. We are also refugees, immigrants, Roms. We have also Roms in Greece. We need to build a great community for all of us to live together. So, with my 15 years of experience in the community issues, I strongly believe that everything starts from the community. The motive "Go Local" totally represents me, and we have great opportunities to make strong bonds uh, to the community, and we need to have a feedback with our citizens about the problems and what is that we need to care about in our community. What we already managed in the 4 years of operation in the community center is that people in our community trust us, trust the professional, and they inform us about anything that worries them and affects them in everyday life. That is the first crucial step for us to create the bonds. Um, so my first goal is to see better the issue of the equality of genders and help women to have a more active role in the community, in the local society. This is my first goal because women are multitask persons since the young ages. Sometimes they lack of education because they had the families and children since the young age. They're staying home, they're having and raising kids, neglecting their own personal needs and rights to be more active in work or in the local society by having a role.
Yeah, yeah. That's good.
And what we faced during the pandemic was the increasing of the levels of gender-based violence in homes. So that is something that we need to care for our local community. And
Very
secondly,
good.
and more generally, my goal is to approach even more young people and help them, influence them, motivate them to start um, uh, taking part in experiential workshops regarding sectors of everyday life, because we saw that many people lack of basic communication skills. That means that they visit us in a public service and they don't know how to express their requests. They don't know how to say it properly or how to handle things themselves concerning bureaucracy. So I'm going to start some workshops also about that. These are my goals and dreams for my community. I think that we have gained a basic level of education, understanding. Things are being
But
quiet.
Maria, I just do completely agree with you. Your perception, your vision to be professionalized on based on community social work. I totally agree with you. But just one question always push me back. Social worker as a social work graduates or a social worker or professional social worker, we all do have nice organizing capacity, counseling capacity, proactive leadership, managerial capacity, interaction, right? Crisis management capacity, strength, self motivation, determination, all these things we have, but still, I don't find what is the basic problem or the root cause to be widely known, or I mean, the social work profession to be widely professionalized. If I ask you just this for a minute, what is the single cause, if you love to identify that, what is the basic root cause, just one cause that keeps social work stay behind till now, as social work rooted more than hundreds of years before, right?
I think that we certainly lack of determination. We need to
Correct.
be more determined to fight for us and the community, for human rights, for human dignity, for all the things. As I said before, we need to reform our social policy. Each country has a social policy. We need to be a part of the reconstruction of social policy.
Yeah, yeah, good.
The needs
And
of people and the global phenomena and everything around us is constantly on a circle of change. We need to be
so
more progressive.
self-determination, I mean firmness among the social worker, which still lacking around the world among the social work community. The same question I faced actually, immediate past president of IFSW, Ruth Stark. I met her several places, but in 2015 in Bangkok conference, I was invited as keynote speaker out of four, and in the pre-session of the conference. And after the session, I declared on the stage that till death I will try to bring social work in a position in my country. I'm not sure how much I could contribute, but I'm firm to recognize me as a social worker because I have been graduated. I did my master's, I did my higher degree on social work. So this is my commitment. It might take time. So Ruth asked me, Habib, I have been rooted from Scotland, and even in Scotland, being the welfare state, being the first, growing country, developed country, it took 19 years to make our government understand that social work is a very nice, very sophisticated, very comprehensible and holistic profession. To be professionalized in our country, it took 19 years or more. How come Bangladesh can get social work as a professionally recognized discipline within few years? I replied her, my commitment is I'm not sure how much I could contribute, but I believe someone should take the initiative, someone should take the leadership. So I can sacrifice initially, that was 2015, but I told and replied her then I my first plan is up to 2030, and if not possible during SDG achieving period, I will extend with my colleagues and teams up to 2041. If not possible, I am ready to dedicate myself or my life to see social work as a profession. So nowadays, it's my passion to be identified social worker Habibur Rahman, not professor, not or PhD or any other thing, because I do believe without identifying my professional recognition, this subject will be fruitless and meaningless. Community will not give you access to serve them, though you have myself having a good heart to contribute to the community. So through this session, actually we are end of this session. Within a minute, we are going to conclude this. So I'm very happy on behalf of my team, on behalf of the whole entire team of Community Talks, CSWPD Foundation, and our initiative from Bangladesh. Maria, our warm felicitation to you and congratulations to you for accept our invitation and finally make the session successful.
Thank you so much. I'm very honored to be a part of this discussion. I hope that everything goes well about social work, about COVID, about the global issues in each country. I hope also the best for you and your foundation and your career. I'm so grateful that I met you. COVID make us meet.
Yeah, right. COVID
That is
made
also
us, right.
a good aspect of the pandemic crisis. I hope we will be surely in touch. I totally agree with you with your aspect about community issues. And we also need to have in mind that we all are also members of the community. And we need to see ourselves on a two-level basis as
Thanks a lot.
members
Thanks a
of the
lot.
community and as professionals. Thank you so
Very
much,
good. Thanks a lot,
Professor.
Maria. Thanks all viewers, those who are watching this show and will be watching later on. Actually, this is a live archive for the future generation. Those who actually love social work will love social work and will contribute their passion and time and professional career for social work. My passion to just capture this video, and my feelings is after my departure from this world, this contribution will be remaining to the fellow social worker later on globally. So that is all. Thanks a lot again. Thanks, Maria, and thanks all.
Thank you very
Goodbye to
much.
you.
Thank you very much. Have a nice evening.
Nice evening. Thank you.